Hi, I'm Annalisa Itcorp, and I'm here today at the Hilton Head Veterinary Clinic. Now today we're going to be discussing dental care. Not mine, not yours, but the dental care of our pets. It's a great program, and to help us with this topic, joining me is my vet, Dr. Kirk Dixon.
Hello, how are you
Welcome.
today?
Now I know you have two locations, one on the north end of the island and one on the south end, but how long have you been practicing veterinary medicine?
I've been practicing veterinary medicine for 24 years. 21 of them have been on Hilton Head.
So you're kind of the old man of the island.
Unfortunately, I am the old man. I've lasted longer than anybody else that's practicing. Yes, I do have the most experience.
Now today we're going to focus on a very specific topic regarding pet health.
Yes, today is dental care,
Yes.
we want to talk about.
Wonderful.
I want to start out with a model because it's easy to show people, but then we're going to move into actual real life patients of mine, real life animals, not fake, not pretend. This is a model of what would be an ideal dog's mouth. You can see that the gums are nice and uniform in color, that the teeth are nice and white, and that there's no tartar on them. If we turn this around, this is an extreme, a bad mouth. All this is gingivitis, this redness. It causes the gums to recede. This is all tartar on here that will get on the roots and eventually cause them to lose their teeth. It is also the source of many other health problems, including heart disease.
Now, I know one of the major concerns about pets and dental care has to do with anesthesia. Everybody, I think, has heard a horror story or two, you know, a friend who knows a friend, or even had a personal experience. Give me the truth about it.
Absolutely, and that's one thing that I try to do is give people more information than less information. But there is always a risk whenever you do anesthesia. You can never say never, you can never guarantee in medicine. However, I do things differently such that the risk is very minimal. And in my experience, in the 24 years that I've practiced veterinary medicine, I have not had a single problem with a dentistry. So as a result, I feel very comfortable with the risk aspect of things. So therefore, I can concentrate on the benefits and how important it is to keep the teeth clean.
Give me an example of what you do differently.
What I do differently is that most veterinarians, they do not personally clean teeth. They have a technician or even another lay staff member that may not have any certification or advanced training that might be cleaning the teeth and monitoring the anesthesia.
So I may think that I'm paying to have my vet do it when indeed somebody far less qualified is taking care of my animal.
The reality is the standard of care in veterinary medicine is that the veterinarian is not the one that's doing the dentistries. I'm different in that I do the dentistries myself. I am the one personally applying the anesthesia, cleaning the teeth, no matter how nasty they are and how bad they smell, I'm the one doing it, and as a result, I'm faster, I'm more experienced, and as a result, I believe that is the secret to my success rate. In addition, I use very low levels of anesthesia so that they only are asleep enough that I can accomplish my work. It is inconvenient for me, but the net result is returning a very healthy and happy animal back to their owner.
Now, who do we have here?
This is Chester.
Hello, Chester.
Chester is a 9-year-old dachshund, and he has amazing teeth. He is my star dental patient.
So this is what you're going for.
This is the ideal. Chester's never lost a tooth, and he has the perfect Colgate smile.
Smile.
Let's see those
Wow.
teeth. See that?
They're
There's
whiter than my
no
teeth.
tartar.
That is amazing.
Let's look at the front. You're such a good boy, Chester. Look at that. Look at those
Wow.
teeth. You see that? We go back to the molars back here. And Chester goes, "Where are you pulling my gums back?" but look at those.
And look at
things.
but his gums are so healthy.
There is no redness. If
No.
you see, there's
It's
no
like
redness.
the model, they're real far down on the tooth.
This is like perfect teeth, and his teeth weren't just cleaned either.
You're a good boy. Well, now let's look at the other end of the spectrum.
Okay.
And who's this?
This is Spanky. Spanky, unfortunately, hasn't had good dental care.
And he doesn't seem happy about it.
He probably isn't, even though he may not know it. But he is an identical age as Chester is. They are both 9 years old.
Okay.
And Spanky, while liking to lick himself there, has terrible teeth. And this is the bad side of the model. Look at those teeth.
Oh my gosh.
Look at that. The gums have receded. This is actually the root that's exposed. It has tartar on it. He has already lost some teeth, and he's going to lose more.
And his breath really stinks.
And his breath stinks so bad, it's like, why on earth do I have to get close enough to clean his teeth?
Wow.
But we're going to help him. Now, the problems that people don't realize what can happen with bad teeth is that they can have heart problems, they can have organ problems, they can have all kinds of issues just from bad teeth, because that tartar is composed of food particles and bacteria, and every day they're shedding into their whole body bacteria and such to attack the body. So every time that we clean teeth, when they're that bad, the owners always come back after a few weeks and say they're more active, they're happier, they're just a better dog. Okay, we've just finished, and this is how asleep he is. You can see he's rolled over on his back. He's shaking a little bit because he's cold.
His tongue's not hanging out of his mouth.
His tongue's not hanging out as much. You can see he's blinking. He's trying to hold. He's uncoordinated, but he's not out.
No, he's not asleep.
And this is a 9-year-old dog.
Because my image is, dog
Right. And this is what I do, is try to keep the anesthesia as little as possible, be as quick as possible, so they have the least amount of potential problems that they can.
That's fantastic.
So we're going to go let him wake up a little more, and then we're going to show you how much better his teeth look.
All right, Spanky, good job.
Well, here we are with Spanky, shiny and new, all happy and perky, and it's not even
Hour and a half, 2 hours
like
afterwards.
that. Now, I want to see his teeth.
Okay, let's look at those teeth. Come on, Spanky, let's show the teeth. A few less
No
teeth.
stinky breath.
Much better breath. Once the infection's taken care of with some antibiotics, he'll be good to go.
You look at that tail wagging.
He's happy.
It's like he knows. I
Boy,
have new teeth.
Doesn't look like a real serious procedure to me. Does it look like it to you?
Nope, I'll be booking my appointment tomorrow, I promise.
Sounds good.
Okay.
Sounds good.
Have a good day, Hilton Head.